Hi, I'm Edong Badong, aka Ed Palero. I've been here, been going to CSA for about almost 10 years, and I got a maintenance with my eye bag on 7 years ago. So now I'm here with CSA again, here in the new place in Infinity. They've been here 5 years, so I've been going here for almost 10 years. That every time I come from the U.S. to the Philippines, I come by and pass by here just to make sure my stress level is down. So they beautify me. I found out CSA from friends, word of mouth, and then I came by the first time here in the O, and I had my facial, and it was a very good experience. I highly recommend you guys see Dr. Contessa. It's a beautiful place, even though they'll make you more beautiful. Don't forget to subscribe and ring the bell. So for more information, you can find out on YouTube.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a returning guest. Let's all welcome back Sir Ed Palero.
Hello, how are you?
So, Sir Ed had an episode with us 8 years ago.
Yes.
And he's been like coming back to the from United States to CSA, from USA to CSA.
Every year?
Yeah, every year from 2017. Oh, even 2014. Okay, ang sharp ng mind ni Sir Ed. So, ngayon, we'll have a treatment that will, of course, maintain what we've been doing. Right?
Yes.
Because it's been combination procedures to rejuvenate the face. It's like treating areas with lines, wrinkles, or sagginess, loose skin. Actually, I was looking at Sir Ed. Sir Ed, like, you look a lot younger now.
Yes.
Compared way back 2014, 13, right?
Yes.
The first time I saw you.
Yeah.
Wait, what have you been doing?
I've been going to CSA every year, and it's giving me the youth, the fountain of youth.
Right.
So I'm 71 years old now.
71? I thought 17. 71. We had a shoot 8 years ago. Your age was 63.
63, yeah.
Okay, so ngayon 71.
Yes.
So probably we'll show the photo when you were 63 and we can compare after 8 years. A lot younger right now.
Yes.
Right?
Thank you.
Welcome. It's our honor, our pleasure to have you with us. For today, we'll do a treatment to also like continue the ones we have been doing, okay? So during the episode 8 years ago, we did an under eye treatment. So we used the so-called filler, a dermal filler composed of hyaluronic substance, which is natural, okay?
Yes.
So 8 years ago, we did the under eye treatment to correct that problem of tear trough, or Sir Ed was saying his concern of eye bag, okay? Now, today, we'll be doing an eye bag correction as well, but we'll be utilizing treatments that will give that longer lasting effect. Okay? Because we know low molecular weight hyaluronic substance, well, they last for 6 months, or others may have it more than that. It depends on the metabolism. But we have treatments right now that can also lengthen the duration.
Nice.
But usually, the best approach right now is the so-called combination approach, or we call it a multi-layered approach, because aging is multi-layered. It's not just on the outer And then we'll be combining it with treatments on the sides of the eye. Okay, so not only under the eye, but we will also work on the corner of the eye to stretch the skin there, because we are seeing already some lines, wrinkles, or some are having the so-called accordion lines. So we still want to sustain collagen formation, and we still want to do some sides of the face to strengthen, to tighten. We call the so-called vertical vector lift. We've been doing that for many, many years. Okay, so we're excited. Sir Ed?
I'm very excited.
Okay, thank you so much. We'll show the treatment when we return. And we are back. Sir Ed, how are you?
Good.
Good.
Excellent.
Okay. So we'll start working with the under eye region. So we want a treatment that will correct the volume, at the same time restore this tightened and kind of firm skin in the under eye area. We know that in the under eye we have thin skin there, and the under eye also has weakening of those ligaments, plus those muscle area, because they just become weaker, and then also the skin becomes thinner because of lost collagen and elastin. So for today, I'll be using those PDO threads, the polydioxanone threads. We'll be specifically using the so-called Dermaspring Eye plus the scaffold thread. So both for volume restoration and also for kind of strengthening, tightening, and collagen stimulation. So I'll start with my entry point here on the sides of the eye here. Okay, just tiny prick. And this is lidocaine. So we'll have entry points on this inferior aspect of the lateral canthal area. So I'll make my 3 entry points first. And then I'll be gliding my Dermaspring with the length of a 27 millimeter, or rather this one is a 27 gauge rather, with 50 millimeter length. Okay, that's the first one. So I'm using multiple entry points, and we'll just glide it subdermally. So the goal is to strengthen the tissues here and collagen stimulation as well. Okay, some sharpness there, and we'll pull out. And then third one, we'll be using 5 pieces of this one, so I'm on the third one, Sir Ed, sorry. Last time we only used hyaluronic, that's it. And the thing with hyaluronic, because it's hydrophilic, it attracts water. Over time, you'll see some kind of effect of tissue expansion. So some cases, they were sharing with me that after they had their hyaluronic under their eye area, they're noticing some lumps or bumps, or kind of like bulges, because your hyaluronic, when you overcorrected your under eye with too much of your hyaluronic, it can create a so-called like expansion of the tissues, and others are noticing the bulge under the eye area, or others are saying kind of like I have additional eye bag. So I'm just on this side here. I remember, Sir Ed, you told me you had blepharoplasty long time ago. Yeah. So I still have patients coming to me. They already had procedures of so-called blepharoplasty, but still we wanted to strengthen the skin, the soft tissue areas, using this protein structural threads. So I'm using now a so-called scaffold. So this is my entry point. Okay, tiny prick. There you go. And scaffold is made up of multiple filaments of threads. So these multiple filaments of threads are around, like, there's a 16 strands, and then it's folded on kind of like inside the cannula, there's another 16 strands folded, so it's a total of 32 strands. Okay, so the good thing with these PDO threads, because you have multiple filaments, the more collagen fibrous tissues will form around it. Okay, so some deep layer here, so we want a structure under the ligament. So the technique right now is to support the retaining ligament that we have here in the under eye area, or the so-called orbicularis retaining ligament. So I'm using 2 scaffold threads here. Now, the final one that I'm gonna do, I've shared with Sir Ed that will work in the deeper tissues. Then we'll combine it with superficial tissues. I'll be using the so-called ColShine. Now, it's a new product that we have. It's an actual collagen already. You don't need to wait for the formation of your collagen. It's a type 1 collagen. So we'll use it right now on the superficial plane to improve that what we call like the surface area to even it out, smoothen it out. So I'll just use another entry point here and glide my gauge 25 cannula here and just go. You can go subdermal, or you can go above the orbicularis oculi muscle, and you can still go submuscular here. So the good thing with this collagen, it's a natural type. We call it atelocollagen type 1, natural collagen, 99.9%. So unlike the hyaluronic that we inject, with the hyaluronic, you still kind of experience some of the volume expansion, and over time you're seeing some sausage-shaped bulge there. That's why when we do hyaluronic, we place it under the muscle. But this one, you can place it above the muscle, above the orbicularis oculi muscle. So I'm just going in and injecting it to the tear trough area there. Okay. Now I'll still add more treatment for Sir Ed. I'll work on the sides of the eye. So I'll be using Dermal Spring Eye, 27/40. So I'm using the same entry point actually, and I'm just gonna glide it into the, you can go with the subdermis layer. Okay. The layer where you have fibroblast cells. You want to target that layer. So I'm just gonna be using the so-called fanning technique here and just glide. So for those who have crow's feet, static wrinkles, static lines here, you can use this kind of treatment to improve that kind of static wrinkle there. So the layer is just subdermal. So you want to stimulate collagen here, tighten the skin, stretch the skin, get rid of those stubborn wrinkles here, because the Botox works on dynamic wrinkles, so we want to treat the static wrinkle. You can even combine with hyaluronic. You can even use your ColShine, and you can also use your PDO threads. So right now what we're doing is a so-called sandwich technique, multi-layered technique. It's treating all the layers that we need to improve, because all the layers will age. Even up to the bone layer, we have aging of the bone. Okay, so the final one that I'll be doing is the so-called vertical vector lift. So Asian face is known for being round, wide, short. Okay, so we somehow wanna elongate and narrow the face. So this is a technique that we can apply for our patients to narrow the face and kind of lengthen a bit to make the proportions equal or balanced. And also for those with concerns of like sagginess on the jawline area here, especially the posterior mandible part, posterior part of the face, we can use this technique. So we want to improve the sides of the face, because right now the lifting method that we do is improving this periphery. You wanna do a lifting of your medial face, you improve this periphery of the face, or the outer part of the face. And I'll be using the product called NFix here, a fixation type of a thread, because this is what we call non-mobile area. So we also want some fixation type of material here. So I'll use the NFix. So I'll make my first entry point here, and my plane will be subcutaneous plane to the SMAS plane. Okay, so it's again improving the sides of the face, do lifting and strengthening, plus restoring support in this area here. So I'm using a gauge 21 100mm length of an NFix. So actually in the past we've already done this to Sir Ed. So I'm just be gliding it and make it linear, straight vertical line. Okay, so we actually injected lidocaine in this layer. So expect some fibrosis because the area is rich with connective tissues. So this one has fibrosis. Okay, so we're just gonna glide up to the posterior jawline there. So we use the entire length of our NFix thread. And our last one, so the last NFix here. So this area, for the anatomical consideration, we have to be careful with the superficial temporal artery, or those vessels, and also branches from your facial nerve. So we're gliding in. So I'm still using the so-called screw technique. So we're doing vertical vector lift using NFix. we want to tighten and firm this area here, the non-mobile area. And once you strengthen this non-mobile area, you're also doing a lifting effect on your mobile area, the medial aspect of your face. So we've done this side here. So we're just gonna pull a bit and then do the cut, and we're moving to the left side. So we've done combination procedures for Sir Ed. We'll show the result when we return. And we're back. So let's now show the result to Sir Ed. Sir Ed, the mirror. We did multiple injections.
Wow.
And you're not a bleeder, and I don't see any bruise. Right?
So
and
pretty.
Very high tolerance to pain. It was like a lot of needles there, a lot of poking, okay? And injecting lidocaine. The lidocaine is, it has low pH, it's acidic, kind of it stings into the skin when you inject it. But Sir Ed was, wow.
Yes.
Tough.
Making me beautiful here.
A lot younger.
Yes, a lot younger.
71 years
Yes.
old. Oh, wow. When you were 63, we were doing your treatment, kind of like you were, ayan na, kind of older during our first shoot with you.
Yeah, I was older.
And now, a lot younger.
A lot younger.
Tight skin, firm skin, lifted skin. So we did the combination procedures. So on the under eye area, we had the multi-layered treatment, and we had used the so-called sandwich technique, whereby we worked in the subdermis, and we also worked submuscular, and we also worked on the superficial layer, subcutaneous layer. So this is targeting the aging in a multi-layered approach. Multi-layered technique, sandwich technique. And we added like those PDO threads, dermaspring, on the corner of the eyes to stretch the skin there, get rid of static wrinkles there, and stimulate collagen. Plus also lifting the corner of the eye. For those who have concerns of droopy eyes or the sagginess in the upper eyelid, this is another treatment. And also on the sides of the face, this part here, Sir Ed. So we did the so-called vertical vector lift, making use of those fixation type of threads. So we wanted to strengthen the sides of the face, because when you strengthen this, it will also have that lifting effect on the medial part of your face. So if you're doing like filler injections as well on the sides of the face, that can also give like a lifting effect on the medial parts of the face. Because this mid-cheek, this jowl here, they become heavy over time. They go down, they sag, right? So we wanna kind of restore the volume and structure on the sides of the face to help lift the medial part of your face, the mobile part of the face. Sir Ed, comments, feedback on your
This is
procedure.
very good procedure, and
Yeah.
I really highly recommend.
Yes.
Highly recommend for you guys to see
Right.
Dr. Contessa.
Thank you.
It makes you 10 years younger.
Exactly, a lot younger.
So, a lot younger.
You don't even need surgery, Sir
No,
Ed.
I don't need to.
Yeah.
I have to see doctor every year
Yeah.
just to see me how I look. And she makes me beautify.
Beautified. And still, Sir Ed, it's not altering his face, because the others are saying like, oh, you've done the procedure immediately after. Some are saying, oh, I don't see any change after. Because usually these kinds of non-surgical approach, they work gradually. It's like you see them as time passes by, because they're working inside and little by little, you're seeing the effect on the outside. It's because, collagenesis, it will happen in 12 weeks time and even like more than 12 weeks time. But we use, by the way, collagen filler in the under eye area. We call it Colshine. We have already given an actual collagen. You don't need to wait for the collagen formation. Okay, so we have newer products, newer materials for like, that lifted look, younger look. 10 years younger,
Yes.
Sir Ed. Yeah.
It's slowly getting younger, not drastically younger, but slowly it makes it more realistic.
Realistic, natural.
That's right.
Aging gracefully.
Aging gracefully.
So no surgery, no cuts.
No cuts.
Like it's been how many years we've been together? 10 years?
Yes.
I know, right? But look at you.
14.
So Sir Ed here, like, he's like the model.
Very much appreciated, doctor.
You're welcome, sir.
I really do.
So a very good testimonial to all of us.
Yes.
So non-surgical approach are really effective and very safe. Of course, the materials that we're using, they were scientifically studied and they have FDA approval. And again, I want to remind everyone that these kinds of treatments should only be done by authorized, licensed, like aesthetic doctors, surgeons, dermatologists, okay? In other countries, we know we have nurse practitioners and they have they authorized some practitioners to perform this procedure. So it will depend which country you are in. But in the Philippines, we have a law that it's only for licensed physicians in the Philippines, okay? So, if you're in the United States, I have friends, nurse practitioners, they're doing this. And some nurses are doing this also. Thank you so much, Sir Ed.
Thank you, doctor. I really appreciate this.
You're welcome.
Making me so beautiful.
It's our pleasure. It's our pleasure. So, we'll see Sir Ed for some follow-ups. And then, we'll still have more projects like this.
Every year.
Okay, there you go. So, Sir Ed, do you have any social media? If you have followers or someone wanna ask questions a little bit.
Yes, you can ask Edong Badong on YouTube.
Oh, YouTube, he has a channel. Facebook.
I have a
YouTube channel.
And Facebook Edong Badong.
Okay, Edong Badong.
A messenger or Facebook.
Instagram?
Instagram.
Okay. And you can also reach us at our Facebook, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And you may also email us at csaskinclinic@yahoo.com. And please do watch our other videos. We had the video of Sir Ed 8 years ago. You can review that. Okay, so thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.